as you become a doctor, you start out on a journey. For the rest of your life, you're going to be lifelong learners. And things that don't make sense now are things that are going to start making sense later as you start to see them in real life.
Hello, everyone. I am very excited because we have Dr. Sarah Nasir, and I am just going to allow you to tell us a little bit about yourself and your journey to medicine.
Thank you so much, Dr. Erkeda, and thank you to everybody with the Prospective Doctor audience. Thank you for allowing me the chance to be here. So I'm Dr. Sarah Nasir. I am an osteopathic physician. My specialty is family medicine, and I'm subspecializing in addiction medicine at this time. I'm located in California. I'm working as a medical director here. And, I'm speaking to an audience who are in their undergrad, probably high school, as well as medical school. So I'll give a little bit more background in that area. In undergrad, I went to UC Davis and I did my degree in engineering, my bachelor's degree. And then I went to medical school in West Virginia School of Osteopathic Medicine. So I was in the East Coast for almost a decade. It's what it feels like. Then I did my residency 1 year in California and then finished up the rest in upstate New York in a town called Elmira. Then after finishing my medical school, I did a 3.5 years of service with National Health Service Corps. So that allowed me to work in DC. Then I finished it up in California, and now I am, working purely in addiction medicine at this time. And also the other fun things about me is that I'm now a full-blown entrepreneur and getting deeper and deeper into that water. So really excited to be doing that, raising what I like to say is nurturing my brain children along with my womb children. I have a daughter who's 4 years old and a son who's 2 years old. Absolute joy, except for the times when they're having a tantrum. But even then, it's a joy to see them, their smile. So yeah, that's basically my curriculum vitae in 5 minutes.
I love that. And for you guys that are listening, it's such a treat because I just mentioned last week that I don't think we had any addiction doctors on, and now we've had 2 in a row because I spoke to someone last week, you guys who are listening. But I'm so excited to dive into this because it seems like we have a lot of commonalities. Like I am also a family physician, and I also did the National Health Service Corps. For the students who are listening, if you're interested in going into primary care, there are programs, and one of them is particularly the National Health Service Corps, where there are different kinds of programs within it. So you can do it like in your first year of med school or your last year, or even when you're kind of already working, and you can get some type of reimbursement on your loan repayment. So while you're serving in underserved communities, whether or not that's in a rural environment or more urban like we did, because I also did my service time in the DMV. So there are opportunities out there for you to serve communities that need it. So at my particular clinic, it was 50% uninsured, 50% undocumented, and a lot of LGBT patients. So there was a lot of learning and a lot of giving that we were able to do.
Yeah, definitely a very rewarding experience. Definitely kept me grounded at times when things got hard. I felt like this was a win-win situation for me because I got the scholarship to pay for my medical school, and then I got to serve the population that I wanted to become the doctor for. I wanted to become a doctor to take care of people, make a difference in the world, and do good. And so I got paid to do that. So that was the beautiful part about it.
Awesome. So a lot of times on our show, for the listeners who have been listening for a while, we talk about all kinds of things in healthcare. So we talk about the journey to getting to medical school, like the other side. We talk about technology, innovation, new ways to practice. But we don't tend to talk about a lot of things that may be going on that you guys are experiencing right now, like the struggles. So we love to talk about like medical education being something where you feel like you're drinking through a fire hose and there's so much information. And sometimes we may have that comparison analysis where we're like, oh my goodness, this person is rocking out those tests. They leave in 10 minutes and they're all getting 100s and I'm sitting here struggling. Or when we get to the clinical realm, if you've done well in the other part, you're like, oh my goodness, I can't figure out how to take a history or how to do an exam. Is it just me? So the elephant in the room is that most students struggle. And I just wanted to just ask a little bit about how you would suggest coping if you've had any academic struggles or setbacks.
Yeah. And as you said, I think the medical process is such an arduous process. It's like going through fire. And so no matter who enters it does not come out of it without being touched by the fire, right? And some people get a little singe, some people get a little burn, and some people come out of it with like in pieces sometimes, right? So definitely there are a lot of, honestly, this is a topic that I'm glad that you asked about because I was one of those people who were on the more burnt side of the well done meat. I was like really well done, right? And so I want to talk to that audience because I felt like going through medical school, it felt like the students that are scoring really high, they had the system figured out. Or at least that's what it looked like to me. So I don't know how much of this content would necessarily be beneficial for them, but I really want to talk to the people who are finding themselves in a situation where I found myself, which was like right at the border, like right at the edge of, falling off the cliff and sometimes maybe even falling off the cliff. In that area, what I found was that it's a very embarrassing place to be because you think everybody around you, you see them, you feel like they're doing great, and yet here you are struggling, right? You have your heart set on wanting to do something to benefit the mankind. You want to do good in the world, but sometimes the numbers that return on your report card might not reflect that. And so, what I would really recommend if you find yourself in that situation, first of all, allow yourself some grace. And give yourself some love because the numbers on the paper, they might be an indication of your understanding of the topic, but this topic that you're drinking out of the fire hydrant, like not even the hose, but like directly out of the hydrant, it needs to actually sit and rest in your brain and allow your brain to develop those neurons in the first place and then start connecting. So as you become a doctor, you start out on a journey. For the rest of your life, you're going to be lifelong learners. And things that don't make sense now are things that are going to start making sense later as you start to see them in real life. So in the medical school and the pre-med, you're starting to lay the foundation of just trying to grab something. And even then, in our current education system, unfortunately, we're given such an information overload, right? That there's no time sometimes to sort through what just hit you. There's a lot of shock and awe, just like shove your face and go and just regurgitate it, is what it felt to me like. And so if you find yourself in that situation, that overwhelm, I would really recommend ask for help. And there is shame that comes up in it. The thought is that if you're smart enough, like to be a doctor, you have to be smart. And smart people get what's happening. They don't ask for help, right? And that was something that I had to struggle with. So know that no matter how smart you are, eventually you will find and come across something where you'll have to pause and think and reflect and digest. You need time. Your brain needs time, and that's absolutely normal. You are a human being. You're not a robot. You can't just put the program in and let it run. It's not like the Matrix. I don't know if kids nowadays know what the Matrix is, but it was a movie when I was growing up where you can just install new skills by accessing the back of your neck and upload a program of a whole new language or whole new martial arts skills that you have never done in your life. So we're not there yet, and thankfully, because this is the journey of being human. And so allow yourself that, because at the end of it, what you're going to do is you're going to take care of human beings. And if you don't have that humanity left in you and you start to lose it, it's going to be hard to relate, right? Because at the end of the day, it's not the MCAT scores or the USMLE scores or the COMLEX scores that's going to make you the doctor that your patients want to keep coming back to. Mm-hmm. It's going to be your warmth, your rapport, your presence, your empathy that they're going to connect with. So try to keep sense of that. Tell yourself you're worth it. Tell yourself your greatness in progress. Because oftentimes when we want to become doctors, we're looking at those who already are wearing the white coat. And they look like great people to us when we're looking up from back in the college days or high school days, right? They had to go through a similar process as well. And definitely the brightest minds are definitely in the fields of medicine, engineering, science. But just because your numbers don't look glorious doesn't mean you're any less. You will just shine in a different way. Maybe the standard of testing is not the one that captures it, and there can be a lot said about it. Hopefully with time things will change. But if you find yourself flickering, and sometimes it can lead to some really dark thoughts, no matter what your scores are, your life, you are so much more worth it. You are worth it, and you are here because you have something that you have to offer. And yeah, I think that's a pretty good soliloquy there, Erkeda. I'm going to go ahead and let you chime in for a bit here.
I love that because I think, like you said, a lot of times we are very hard on ourselves. And a lot of these things are internal because you come in and you are like the best and the brightest. Like it's very competitive to get into medical school. So you're all brilliant. Like you've done the things, but a lot of times these are the first time that you're experiencing and learning these things and you're growing those new neurons and all of those kinds of things. So it's okay to slip out. Some people haven't had the same testing styles at their other institutions that we're having, where now you have to come in and you take these standardized exams. You have to do a lot of memorization in certain phases. But now, like, it changes from like that memorization where you have to know these things. You have to deal with patients. You have to understand the process. So it can be an adjustment for people, but you're going to adjust. Also, like kind of like what I mentioned before, like everyone has a time where they struggle. You may do very well in a certain area and then do not so well in another one. That's why it's very important to build community and talk amongst yourselves and not struggle in silence. Like, I love that you emphasize like asking for help, because sometimes people can get embarrassed or shameful, but it's not anything to be embarrassed about. Everyone's going to have their struggle, whether or not it's during the preclinical years or the clinical years, or even if you don't struggle in medical school, you may have a struggle in residency with the schedule and all of those things, or even when you're an attending, like attending struggle. So yes. there's always that point. So kind of just sit there, and when you are coming upon a struggle, reflect and see if there's anything you can do differently to change, and then ask for help. Like, lots of people would love to offer solutions and help if they can. So don't wait until it gets too far where you not done well or failed several exams and you're kind of in a bunch and you might be needing to meet with certain deans and things like that. Because that can happen with some people, but sometimes try to work on being proactive, because when you're in medical school, you are an adult learner. So they want you to kind of recognize things. Like, they expect you to have some slip ups, but recognize when things aren't going in the right direction so that you can kind of turn around and find your best way to navigate your journey through medicine.
Yeah. And I think that was a very important note, that ask for help as soon as you recognize that your grip is loosening. And sometimes, when you are just learning how to not sink, you don't have the senses to figure out how to navigate out of the storm, because that's the story of life. Struggle is going to be part of your life story, no matter how big or how small. Everybody's struggle is significant in the spectrum of their life, right? So your struggles are significant. It's nothing to be undermined. And when it happens, new experience, you're not prepared for it, it will catch you off guard, and there's nothing to be ashamed about that. And there's nothing to feel bad about that. And I know it's easy to say that you don't feel bad, that, you will catch up. It's easy to say that. Mm-hmm. But when you're going through the storm and you're getting cut by the, sleets and the hails that are falling on you, it still hurts. And so at that time, I would really recommend, as you go in, identify some people in your life that can act as safe harbors for you. That if you feel you are in trouble, you can go and turn to them for help, because not everybody around you will understand your struggle. And so that was something that in my case, I wanted to reach out for help, but I didn't know who to reach out to. Right. So, that's one of the reasons why I'm showing up, and I'm putting myself out there despite a lot of insecurities that I had to come through, because nobody comes up and says man, that sucked. That was really hard. I fell flat on my face. I got lots of cuts and bruises. Nobody comes up and shows that. Everybody wants to only put their best face forward, and there's good in that. But sometimes it's nice to know that there are others who have gone through it and they have come out of it, and you're going to do it too.
And I love that you pointed out having this sense of community, because sometimes we feel like we're in it alone. And everyone has different personalities where they may want to study by themselves, or they may be a little more shy, so they haven't necessarily connected with people in their class and things like that. So it may be a good idea to maybe get out of your comfort zone and say hi to people, maybe study once a month with someone, so you'll have that community that you're building. And outside of that, building people who can advocate for you, mentors that are in the field, going and talking to people in the family medicine interest group, or the clerkship director, and getting them to know you and to know your face, so that if a struggle were to come up, they'd be able to figure out who to tell you to go to, because you're navigating this for the first time, and they may have seen multiple students have similar situations, or even going to the Office of Student Affairs and getting to know them and things, because they can kind of help guide you and let you know where to go and how to get the help.
Yeah. And I think that's really important, to find your community, to find your tribe. And sometimes even if they're not physically in front of you, now that we live in the digital age, it is much easier to find somebody. Even then, it is so hard to say, I'm struggling academically, I need help. You can go, you can smile with people, you can try to gauge and see if anybody else is hurting like you, but it's sometimes hard to find it. I've been there, and I'm speaking from that experience. I mean, I can get along with people very well, but when it comes to asking for help or learning how to advocate for myself, I definitely struggled with those. Right. And it's something that seems to come naturally to some people, and some people need to hear from podcasts or places like this that, you're not alone. There are others who have gone through it, and they know exactly what you're going through. And so don't hesitate to reach out to them.
Absolutely. And that brings me to one thought that I've heard from some people is, like you said, sometimes it can be a pride thing where you don't want to share that deep part of what you're going through and stuff like that. And it may be very difficult. But sometimes when people do share it, there have been discussions that sometimes students or even residents may actually face academic bullying when they've been struggling and they share it, or people know and they broadcast it. How would you suggest that someone who's going through that deal with that, especially if they're around their colleagues or friends or even their superiors?
Not being able to mix in or blend in with the rest of the crowd, in terms of your GPA, your scores, does sometimes make you a prime target for some personalities that find their ways into these areas where maybe they experience some sort of trauma in their past, or whatever their reason is for having those definitions, that if they don't fit in or if they stand out in a certain way, that personality is attracted to those students who have lesser power, to be able to advocate for themselves, or they're still so fresh, they don't know right from left or medial from lateral or anterior from posterior sometimes, right? They just know how to pick that person up and then break them apart. I don't know what that psychology is. That's something maybe that needs to be looked more into. It's not talked about at all. But when you do find yourself in that situation, once again, the recommendation becomes identify some safe people, right? Identify attendings or anybody who has about equal amount of power as the person who's targeting you. Make sure that you are involved in a group, right? If you're in residency, stay up to date with your class. They might not be seeming to go through the same issues that you are. And if you find that you don't have anybody within the program to ask for help, ask outside of the medical community for help. And ask for help as soon as you start to feel those spidey senses going off and they're telling you that something is off, go and ask. And sometimes, for folks who struggle academically, it tends to be a pattern. So it ends up being like an injury that builds over time, and it starts to kind of erode the confidence that you have in yourself, that courage to speak up goes away. You feel like I'm the one who's in the wrong. So it makes sense that I should be, dealt with like this, that if I am not smart enough, how am I going to take care of a human? How am I going to deliver a baby? If I don't know my right from my left, etc. If I don't know my anatomy, how am I going to help? That is true. You do need to learn the skills and you do need to gain the knowledge. You do need that to do your job. You do need to become competent to be able to do what you're doing, but you don't deserve to be picked on.
Mm-hmm. That makes so much sense. And you're so right about going and asking people for help. My next question for you is, the medical education system is kind of wonky, like we've kind of alluded to. What is something that you would change about the medical education system?
Yeah, that's a great question. I think both the medical education system and the practice of medicine need to become more customized to the student, to the patient. Because if you're delivering a service here, in a medical school, your service is you're delivering education, training, competency, and skills. And so it should be the responsibility of the deliverer, of the market that's trying to sell this product of education, medical education and experience. They should invest more in figuring out how to make the knowledge more relatable and understandable by understanding how the student learns, and then figuring out how to make it relatable so they can keep up with the speed and keep up with gaining the competence. And then in healthcare, same. When a patient comes to you, you should sit down and listen and give them the care that they need based on them. Your last patient and next patient might both have diabetes, but they have different lifestyles that they're leading, and you have to meet them where they're at. So I guess education has to meet the student where they are at. And then the second thing that I think it needs to focus more on preserving humanity. I think in the process of us becoming doctors, the training definitely makes us superhumans, because when you have to learn how to be in 5 places at the same time, you kind of learn how to stretch your presence, right? And that's actually a cool trick to pick up. But that doesn't mean you have to lose yourself in the process. Your ability to feel, your ability to feel pain, feel happiness, feel joy, feel sadness, I think that needs to be brought back. We have been dealing with medicine in such a cutthroat, pedantic, my word is the law type, style, that we forget that the best way to teach is by leading by example. So if we want our students and our future doctors to be able to talk to our patients like a layperson, we need to be able to teach our next generations of doctors also as, not as lay people, but as somebody who is connectable. That humanity also needs to be taught and passed on. I hope that made sense.
It does.
But those are the 2 things I would change.
I couldn't agree more. number one, you definitely need, I think, in the medical education system, like we've advanced enough and there are so many studies and theories on whatever on adult learning that we can personalize education for our students and our next generation of doctors. So education needs to kind of pick up with that in terms of like how you teach information, how people receive it, how people are tested, and all of those things. And then, of course, we need to bring humanity back into medicine. We are in a digital age and everything's tech focused. And y'all know I preach that, but we have to maintain the humanism in medicine. And not only just in interacting with patients, but the way that we deal with ourselves. Like, especially like us in family medicine, you could go from one room where you're congratulating someone on a new pregnancy that they've been waiting for to the next room where you're diagnosing someone with cancer. So it's okay to have a moment. You're not a machine. It's okay. It's okay to go cry. Like, you're human. It's okay to use the bathroom. Like, some people don't drink water in clinic because they're like, I'm going to have to go pee and I can't be late. Like, you're a human. Just apologize for it and be like, okay, I had to take a step to the restroom and keep moving. But we have to eat lunch. We have to drink water. We have to humans. And then that will bleed into our patients.
And it needs to start at the top. It needs to go from top to bottom. I know it's easy to say this to the students, but if the attendings and the teachers, we maintain the air of, hey, you can't sit down. If you're a student, you have to stay standing, or be like, you have to be here, like, inhuman hours of the day, because the predecessors, they didn't have the 80-hour-a-week limit, etc. Right? So definitely it needs to slowly go from top to bottom. But it's not like technology can actually help us be more human, right? It's about how do we set the standards for ourselves to interact with each other and to interact with things that, like technology, that makes us who we are. I think in those are also areas where we need to make sure that we're accommodating for the difference of between person to person, right? There is no normal human. Is something I learned back in engineering, is when we had to design a seat belt or whatever, we were doing a case study on that, and they wanted to make it for the average human. And what they found is that there really isn't an average human. You can go for a bell curve, but there is nobody who has exactly all the features of Norman, the normal man. That was the name of the case study that we had to use, Norman.
That's really interesting. And that can feed into a lot of different things. Like, nobody's a Barbie, but that you make a lot of sense. And we do have to bring the humanity into leadership, like you said, because a lot of these things are perpetuated through lived experiences of their predecessors. Like, we did it, so you're going to do it. And why make people suffer? Like, you can hear through attending saying, like, did you know this student asked for what time is lunch? And did you know they wanted to go home early 30 minutes because they had to go to a session? Okay. What? Yes.
Or the other thing is something like, the concept of pimping. Mm-hmm. You have to pimp in front of others, and there's that element of humiliation. I mean, it's one thing to test someone's knowledge and try to encourage the rest of the group to step up to the plate. There's maybe a reward-based system would be better rather than a humiliation-based system, but for some reason, the thought is that that's what builds character. It makes you stronger. I don't know about that. But definitely in the leadership level, there needs to be more things in place to protect these new bright-eyed hatchlings. Is something that I like to say, that, you have things in place that teaches attendings how to also, deal with the bright students and residents, as well as the residents and students that need help. Also, maybe programs and schools, they need to have a system in place where a student that is struggling, they have an academic student-based, student-facing, student advocate type group where students can go to, because there's a lot of intimidation factor that comes into place as well when you say, I have to go talk to the attending, but he or she is at the same level as the power above me. That's, making me feel embarrassed, humiliated, and unworthy, And there are students who need help. And, medicine is sometimes not cut out for everybody, but that doesn't mean that your dream of taking care of humanity and serving humanity ends there. You might have certain strength that is going to be served better in another field, and you're going to impact so many more by doing that. So being able to also have that, smooth transition without being, because it feels like when you can't be in medicine, sometimes it feels like your whole existence becomes meaningless. Like, what have you been living for? What have I been alive for? Right? It feels like your whole existence comes to question. Mm-hmm. So that's like a mourning that needs to happen in a proper way. And we're not equipped with that. We don't do that. We just sometimes kick the student out and then that's it. The schools or the programs are done. They have nothing else to worry about. On to the next person.
We may have to have another episode on that because it couldn't be further from the truth. I know that the listeners here have heard me say before, for those who are pre-med, if there's absolutely anything that you want to do aside from being a physician, try that first. And if the passion is still in there, come back as someone who's traditionally went straight through. I think that the lived experiences add a depth of knowledge, empathy, insight to being a medical professional. And then I have had several friends who have really, really struggled in medical school, and some of them have gotten excused from the system, and they're doing extremely well. Like some people are dentists and they went a different route, and some people are doing other things. And even once you become a doctor, like I kind of hinted and alluded to it earlier, how people may struggle when they're in attending, and some people get to like that 5-year, 10-year itch when they're out and they're like, what else is there? So there are so many skills that are transferable that you're learning in medical school that you can use and become an entrepreneur. You can become some other thing. You can go in pharma. There are so many options out there for people in medicine that we just have to think about that. And I'm not saying that to like deter you from doing this. There have been many nights where friends and I would joke around like in medical school and we'd be like, well, if I dropped out now, I think I probably wouldn't even be like qualified to work at Sephora because all I've been doing is like volunteering at like hospitals. And like, I know nothing. You know a lot. So.
Yes. I think one of the most amazing things about the people that are attracted to medicine, aside from their heart, like the size of the empathy that they have for humanity, is their ability to adapt. And, that's like oftentimes, as you were saying, like the doctors who get the 5-year itch or whatever, oftentimes they go and they do some pretty amazing things in totally different fields. As Dr. Erkeda was saying, like I wholeheartedly agree that this is not a pitch to get you guys out of medicine, but this is a pitch to help you find yourself and love yourself and serve from a place where it adds to you. And the worst thing that can happen is if this world loses you. And that's the one thing that I hope at any cost you don't do. Okay? Because being a doctor is a high and lofty goal. It's nice, but nothing is nicer than you being you.
I couldn't agree more. I thank you for that. And you've shared so many pearls of wisdom. We'll definitely have to invite you back. But I want to give you an opportunity to tell our audience goodbye as well as where they can find you.
Why, thank you. Yeah. And so, this journey has led me to what is called coaching, right? And I've found that I needed it for me to be able to get out of the hole that, I felt like I had sunk into. Even though everything that came in my life, I had everything that, the doctor code promises. Just the journey had really worn me out. And I wish I had help at the beginning. Somebody to help guide me and tell me that this is, things not looking shiny is not the definition of success, that success includes failure, and that you fall and you get back up. And as you keep getting back up, that's where the success is sustained, and that is how it's achieved, right? And so I think that is one of the ways I would love to show up and serve anybody who needs help. I have a company called Transcendent You, and the goal is to help create transcendence, because we're all greatness in progress. And it is to help you find that path to you, to that great version of you. Right? And so you can find me. I'm on Facebook. It's a mouthful of word to spell, but the way that transcendent is spelled, I don't know if you can see my label, but I intentionally misspelled transcendent. It's TRANSCENDANT, like a transcendant, like a confidant, right? I don't know. I need a little help with pitching my name here. But hopefully you'll be able to post my social media handlers, but I'm on Facebook, I'm on Instagram, and my website is bit.ly/transcendent, TRANSCENDANTYOU. I like that word. I know it was a mouthful, but I love it. I think it really shows the goal that I'm going for and what I'm trying to bring out in people. So thank you.
And we will definitely put your links in the show notes. And I definitely appreciate you for taking the time to talk to all of our listeners. For all of the listeners out there, if you have any questions, feel free to reach out. If you have any recommendations, you can reach out to me. And I'll see you again next week with a lovely guest. Bye.
Thank you for having me. Bye.
Each episode of the Prospective Doctor podcast is brought to you by Med School Coach. To access articles, videos, webinars, and free tools to help you succeed on your journey toward medical school and beyond, visit our website, prospectivedoctor.com. We hope you tune in again next time.